Alright, so this is group 3. We did our research on smallpox. So smallpox is also known as variola. The variola virus is what causes smallpox. Smallpox is an acute, contagious, and sometimes fatal disease. It is noticed by its distinct progressive skin rash that occurs all over your body, as well as a high fever. The last seen case of smallpox was in 1977 in Somalia. After that, the World Health Organization considered the disease eradicated in 1979. So 2 years after that was discovered, the World Health Organization decided that it was eradicated or controlled. So smallpox can be spread from contact with infected persons. Generally, direct and fairly prolonged face-to-face contact is required to spread smallpox from one person to another. However, it doesn't always have to be like that, because it can be spread through direct contact with just the infected bodily fluids from the infected person, or if the bodily fluids somehow get on bedding or clothing, or let's say you use a razor or a toothbrush of somebody that's infected, that's another way to spread it. So the symptoms of smallpox begin with your high fever, your headache, body ache. Sometimes people vomit. Then there's a rash that's well known and that spreads and is very progressive. It moves to being to raised bumps, and those raised bumps become pus-filled. When they become pus-filled, they're known as blisters. When they become blisters, they crust, and then they form a scab, and eventually they fall off. The scabs fall off within about 3 weeks or so, and when they fall off, they leave a pitted scar. The symptoms usually don't occur right away. They usually take about 7 to 17 days. Usually it's 12 to 14 days, they say, on average, for your incubation time. So before you start seeing symptoms, the incubation time is 12 to 14 days on average. During the time of incubation, you don't feel anything different. The person who's infected, doesn't really know, because nothing really changes in their body. They don't have any signs to look at. So the diagnosis for smallpox, it can be based on a couple different ways. The first one is your clinical signs and symptoms. So this would be your high fever, your headache, body ache, and then the progressive rash that happens all over your body. It's very distinct in the kind of rash and blisters that it makes on the body, so it is easy for a trained eye, such as a doctor, an MP, or a PA, to recognize. Otherwise, there are 2 other definitive methods to diagnose smallpox. The first one would be the isolation of the virus from the blood or lesions. So this is where your healthcare provider would take a swab of a lesion that is open, or they would draw blood from you. They would send it to a lab. The lab would isolate the virus, and that's how they would diagnose that you were positively diagnosed with smallpox. Otherwise, the second way they can do it is by identification of antibodies in the blood. So this way, you would have your blood drawn, it would get sent down to a lab, and they would find that your body has made antibodies to a virus, which would be smallpox, that entered your body. So your body is already trying to fight the virus off, and that is how they know that you are infected, when your body starts to fight against whatever has entered. So the treatment for smallpox. First off, there is no cure for smallpox, and you need to get a vaccine administered. Up to 4 days is the longest you can wait after the exposure to this virus, and you need to make sure that it is before the rash appears. The vaccine is to prevent the rash and really prevent any of your symptoms from getting worse. So it essentially lessens the severity of the disease. But there is really no effective treatment other than just management of symptoms. So the number one goal is to be comfortable and not necessarily kill the virus, because we can't, but to manage the headaches, the body aches, the high fevers, so on and so forth. As of right now, there are multiple different chemotherapeutic agents that are under investigation at different labs, and they are currently still trying to find a true treatment for smallpox. Other than that, that is our smallpox presentation, and here are references.